back myself. Thank you all so much for the invitation to join you all tonight. And, you know, we can get invited to come, but it really doesn't mean anything if there's not a good audience. And so thank you for giving your night tonight to hear what we have to say and to give us a chance to hear the questions that you have on your mind. As many of you know, because during the years I was in the legislature, if you were actively involved with the State Medical Association, we probably had an opportunity to have discussions. So it's not surprising to some of you that I have to start out and say, I'm not doing anything I ever planned on doing when I was a child. Because I can remember on my achievement test, when you had to write down what you wanted to be when you grow up, I didn't know there was a word for it, so I used to write down children's doctor. Because I always wanted to help take care of kids, and I really and truly, I enjoyed the doctor. I enjoyed my doctor, so I had good doctors, good bedside manner, probably had a good way of talking to my parents and helping lay a foundation that has made medicine an important part of everything that I've tried to do in my community, in volunteer work, or certainly as a member of the legislature. And it was actually at the end of my first term in office when I had the opportunity to carry legislation, my first piece of legislation dealing with health care. And over those 12 years, I had a chance to try to help improve childhood immunizations by increasing the number of diseases that we wanted to immunize for. I had an opportunity to work on screening for newborns in their hearing, trying to make sure that we had a better opportunity to catch problems, and having a sister who's deaf in one ear made it even more important because I had seen issues that she had when she got to school, and if they didn't know, maybe she wasn't seated close to where the teacher was talking. It's just like children that have vision problems and aren't seated where they can see. I guess now it would be the smart board, back then it was the blackboard, but where they can see what's going on. I've carried legislation dealing with mammograms, colorectal screening, breast cancer treatment fund, and certainly even telemedicine. The first piece of legislation was Senator Ben Robinson to try to put into statute a belief that the state of Oklahoma should try to look down the road and figure out what we could do to put ourselves in a position so that physicians around the state and specialists around the state would have an opportunity to access what was going on in rural parts of Oklahoma, because that's where I came from, Duncan, Oklahoma. It's still my home now. And I know how difficult it is to try to make sure that we have the right access to care and that we have quality of care. You know, the choices are a little more when you're closer to the urban areas, the cosmopolitan parts of the state. But sometimes it's hard to find that kind of health care that you're needing in rural Oklahoma. And so that has always been a focus of mine, whether as providers from physicians and nurses or related fields, or whether it was our rural hospitals and what we can do to help them, or even emergency medical services about how are we going to help these small communities afford those ambulance or transfer services so that people can get where they need to go for that kind of care. But probably what I'm most proud of is that during the time, I think it started in about 1998, I passed the first legislation anticipating that there would be a settlement in the tobacco lawsuit that was going on around the country. Passed legislation to put that money into a trust fund, but it got vetoed because there was, I think, speculation that I had some ulterior motive other than trying to protect it from legislators like me. Just trying to put it in a fund, so we just didn't interest. 2 years later, we were actually able to send State Question 692 to a vote of the people, and it was because many of you in this room talked to your legislators and talked to those of their constituents who said, you know, this is the right thing to do. And so we did that. And the whole purpose of trying to put that money into trust was so that the interest could be earned and spent in a way that would help improve Oklahoma's health. You see, as a state representative, I didn't just receive, I actually read Dr. Finker's State of the State's Health. And it was really frustrating to see year after year efforts of people who really wanted to make an improvement, but we didn't seem to do much at the state capitol. We never seemed to get very far. I have seen a lot of improvements in terms of specialties that have, or special centers for treatment, like the diabetes center that's being built and cancer treatment centers that are being built around our state. But in terms of everyday, average primary care, we're still lacking in many ways in parts of Oklahoma. And a lot of the people of Oklahoma don't go to a doctor. They show up in an emergency room, and that's not good for anybody. Because usually by then, their affliction is so far along that perhaps they could have been treated better earlier if they had had that kind of access or been able to go to a doctor, or they just take up the space of someone who really does need more emergency treatment. So Oklahoma has a long way to go. And it's having been involved in those issues and having been involved with many of you as we talked at the state capitol and worked on legislation to try to make sure that we didn't run you out of state, that we kept you in practice in our state, that we could do whatever you thought was necessary to try to keep insurance premiums low. I was proud to stand by the side of the doctors. And I think it's probably because of that that I have been very fortunate and blessed to have received from the Oklahoma State Medical Association their Friend of Medicine Award, and the Oklahoma College of Medicine a Friend of Medicine Award, and even the Association of Family Physicians in the state of Oklahoma has honored me a couple of times. And I guess it's because they know that my heart is really in making sure that our doctors have the tools necessary to treat the patients that they're trying to reach. And to also make sure that the people of Oklahoma, the families of Oklahoma, have an opportunity to find that practitioner that they need to help them. So I look forward, as governor of this state, to trying to continue those efforts, but at the same time, trying to continue the efforts of those who believe that the Kids Coalition is right when they say we've got to change what we're doing in our schools. We have to make those differences in our children's lives, or our numbers of children with diabetes, with high blood pressure, with heart problems is going to continue into their young adult and adulthood. That's not the future that I want for Oklahoma. That's not the future that I want for these Oklahomans who are our next business leaders, our next elected officials, our next leaders in charity. We have to help prepare them with good health so that they can be better prepared to be well educated. We have to address the poverty issue in this state. When 1 in 5 children in Oklahoma go to bed hungry, that's not sufficient for the state in which I live. When children go to bed hungry, they end up going to school hungry, and we do not give them an opportunity to achieve at their potential. Oklahoma has a lot of issues that not one person can solve, but people who come together who have like minds and like thoughts and like goals can help solve those problems. I've always been a believer in collaboration and in listening to what you and people like you, the Oklahoma State Medical Association and other medical entities have had to say. Your advice has always been good to me. Whether it's trying to make sure that doctors and patients have that choice for the doctor that they want to treat them. I understand that that's important. In rural Oklahoma, you don't have a lot of choices, so you really want to be sure your insurance plan is something that allows you access to a doctor that you know and that you trust, so you can build that patient relationship. So I pledge to you as your governor that I'll try to continue the work I've begun, and I'll try to continue to carry on in a way that you know that the door is open, where when there are issues that you can come and talk with us. In 2004 was the last time I had the privilege to stand up and defend the medical community as we were debating legislation, tort reform on the House floor. There were members of the legislature and recommendations from the insurance commissioner to abolish PLICO at that time. But you all, some of you came to us and said, give us a chance, let us make some changes because we want to be able to take care of ourselves. And we stood up and fought for you, and things have changed. And things are better. They're not perfect, but certainly they are better for the physician's liability insurance company. You all helped us know what we needed to do, and we were willing to help make sure that those changes happen. I can tell you can have more of the same with us as governor. We hope November 2nd you'll make that choice. I look forward to hearing the questions you ask us later. Thank you.